Good. When it comes to BPD or borderline personality disorder, not to be confused with bipolar disorder, which is, same acronym. um, what do you feel are some common misconceptions about borderline disorder or some myths that you've come across?
So there's a lot of misinformation in the media. Most recently, last year with the Amber Heard trial, BPD started getting a whole bunch of attention and not in a compassionate, educational way.
Mhm.
Um, there's a lot of misunderstandings, and I would say the biggest one is that people with BPD don't get better. I'm doing air quotes because that's not true.
Mhm.
We used to think that we being academia because we didn't have a treatment for it. And so people weren't getting better because we weren't treating them effectively. But that doesn't mean that that's true in the present. It just sounds like that's kind of been handed down from, generations of supervisors to supervisees. And unless somebody actually is curious enough to go look into the research because they have a particular interest in that population, they're never going to know that that information is outdated. So I think that's definitely the number one most harmful misconception.
That you have
And
this thing and you're always going to have it and there's no cure, and the best you can hope for is to just survive.
yeah,
Right.
and that's really, I mean, how could you possibly get somebody motivated for treatment if you say that to them on day